This portion of Nightcap is brought to you by Renova.
An estimated 2 million Americans suffer from carpal tunnel syndrome. In fact, you may have Googled it if the symptoms have stopped you from typing right here, right? If that's the case, don't sweat. Just let the Googlechondriac's fingers do the walking. And our friends at Renova Hand Centers do the talking.
You've probably heard of carpal tunnel syndrome. It's a painful condition caused by repetitive motion, including typing and the other usual suspects.
Yes, we are seeing more carpal tunnel syndrome due to more activity with technology, using cell phones, using computers, emailing, sending emails, sending texts, and we're seeing more of that. Hi, I'm Dr. Laredo, a hand surgeon at Renova Hand Centers, here to answer your Google questions.
A logical question is, what are the symptoms? Well, that's easy. Tingling, numbness, and weakness point directly to carpal tunnel. Painkillers, rest, and therapy can sometimes take care of the problem. If not, surgery may be the answer. It is for an estimated 500,000 people every single year. Dr. Laredo says being early rather than late is a good idea. Don't try and tough out carpal tunnel.
First, some people think, oh, it's just a nuisance, I'll shake it off, but they don't realize that that little nuisance can cause injury and damage to the nerve that can be permanent and lose function of the hand. You won't be able to do the opposition of the fingers.
That's scary, but Dr. Laredo says the surgery to fix the problem isn't just 2 small incisions. Dr. Laredo takes it from here.
And afterwards, we put in a clear cannula to see 360 all around the actual anatomy, to see the nerve tendons. And then we put the camera the other direction. So once we have the clear cannula and the camera, then we put our little blade to release the ligament, to get the compression off the nerve, to allow the nerve to heal itself and make itself better.
The entire process takes about 5 minutes. Dr. Laredo says after a week in a splint, you're good to go. Not that long ago, patients were in a splint for 6 weeks and then rehabbing for 6 weeks. Bottom line, you may not need surgery, but if you do, don't wait. Dr. Laredo offers this final bit of advice. See an expert.
A trained, fellowship-trained hand surgeon just does hand surgery. So he's an expert at that. You want an expert. Someone's going to take care of your hands, which are the most vital parts of your body.
Watch that story again, shared with your friends. It's on nightcaptv.com. Also, check out our app. It's Nightcap TV.
So at some point,